Hi there, my name is Carlo Renato. I'm a chiropractor from Sydney, Australia, and PhD candidate in vestibular neurorehabilitation. I thought I'd take the opportunity to maybe share with you some of our content that Ulrich Sandstrom and myself will be presenting in Oslo, June 15 and 16, in a mere 7 weeks away. So we're certainly looking forward to it. We're putting together a great package, the content of this two-day workshop is going to be something not seen before. The title of our talk is the Integrative Protocols for the Cervicogenic Patient. So where Ulrich, as you're no doubt aware, has a very sports orthopedic-based background, has been teaching for a number of years in Europe, South Africa, I should say, and has been doing a great job of it. I've been following his work for some time. So his obviously interest is more the orthopedic aspect. Myself has always been neurological based. I've done the sports training in the past. I've come from a background of sports orthopedic, but my interest in the last 10 to 15 years has been neuro-based, obviously with development of various neuro programs, doing a PhD in vestibular neurorehabilitation. It makes sense that we combine forces together and present a vestibular neuroorthopedic rehabilitation approach to patients with musculoskeletal conditions. And we focus on the cervical spine because we see so much of it in practice. But unfortunately, I think, to date, we've not seen a good neuromusculoskeletal based program that can be succinct, not run necessarily over many weekends, but condense it into a short program, be able to provide it for the practitioner in mind so you get the best bang for buck. So we've condensed it into 2 days, the full 2 days. So you're definitely going to walk away with a lot of content. It's a very practical workshop that we're proud to do. So there's theory behind it. It's all referenced, but where the nuts and bolts are is how is it that you can integrate it in your practice, and how is it you can develop those skills to be able to use it immediately in practice as well. So our focus is going to be on the neuromusculoskeletal approach to managing patients with whiplash, concussion, cervicogenic dizziness, and chronic pain. And you may see some disparity in that, but in fact, there's a lot of common ground in that. And we're going to talk to you about why that is and how is it that you can see it. If you've been in practice for more than a week, you'll know that the cervical spine has huge bearings on overall health, overall pain symptoms, balance, visual stability, symptoms of dizziness, and how it also can be influenced when there's a whiplash-based injury and in particular a concussion as well. So we're going to break all this down. So I'm going to spend a bit of time going through some of the content that I'm going to be covering. Ulrich will probably do something similar as well. I'll put Ulrich on the spot now, so he's going to have to do something similar. But let's go through this. So, Ulrich and I have joined forces because we share a very common principle in that our aim is to educate primary healthcare practitioners, whether it be chiropractors, physios, osteos, even medical practitioners we've had part of our program, in the area of vestibular or neuro-based rehabilitation, and how we can translate the evidence that we're obviously pushing towards, and hopefully I can contribute with my research, and how we can guide practitioners in providing contemporary, well-judged care, or if not, when to refer to the right person as well. And we'll talk about how that can be in practice. So the goal is to improve the clinical competency of practitioners and their patients, and the outcome of their patients, for people suffering from dizziness, vertigo, whiplash, concussion, poor balance, and chronic pain conditions. So that's going to be the mantra of our weekend and work probably moving forward as well. We want to upskill practitioners, make sure they've got all the right information and they can improve the patient outcomes with people suffering from those sorts of conditions. So the topics we're going to cover, we're going to go through an introduction about the prevalence of whiplash conditions, chronic pain, concussion. Ulrich is going to spend a lot of time, in fact, most of day one, talking about the musculoskeletal or the sort of the orthopedic aspects of management and rehabilitation to cervicogenic disorders. He comes from a background that looks at a lot of sporting athletes. So he'll look at spine, shoulder, TMJ. He'll be looking at aspects of chronic pain, using research from a lot of my colleagues in Australia in how to manage that regarding to chronic musculoskeletal based conditions as well. On day 2, I'll take sort of the reins of day 2 and look at more the vestibular neurorehabilitation aspect of cervicogenic conditions. And we're going to look at vestibular, we're going to look at balance, we're going to look at ocular motor, and we're going to look at sensory motor. We're going to tie in a lot of the research that colleagues in University of Queensland, Julia Treleaven and co have done, and we'll tie that in really nicely to our presentation. And then at the end of day 2, all this information is great, and all these workshops on how to do these things are great, but how do we tie it together? And we're going to look at how to integrate it with some case studies. We'll also look at doing some Q&A from the audience, and we'll field some questions on things that are probably burning or questions that you have in your mind that you may want to ask us. And that's all packaged in that 2 days. I'm going to spend a little bit of time talking about the concussion, because whether you are or are not aware, concussions can have a huge impact on one's neck. And it's not just a brain-based injury. There's a lot of cervicogenic components to that as well. And sometimes it's very difficult to dissociate between both or differentiate between both. So we're going to talk about that. We're not going to, a section of our coursework will be devoted to this, and probably something that we'll develop at a later stage. And we're going to reference, as we are with all other content in the weekend, with regards to concussion. There were seminal papers that were produced about 12 months ago in the Journal of Sport of the British Journal of Sports Medicine. There was a number of consensus papers that were produced in that one journal, and we'll be citing that quite frequently as well. Okay, and we'll be talking about the mechanisms of concussion and how it relates to cervicogenic issues. We'll talk about some of the pathophysiology of it. We'll talk about the risk factors and who makes up, who are the people at higher risk from sex, age, other cognitive or precursors, cognitive precursors that may predispose people to concussions as well. So we'll talk about that. We'll talk about the symptoms that are very prevalent and how someone with whiplash and someone with a concussion, how a lot of these symptoms overlap. And we'll make you aware of this so you don't miss this in your clinic and patient cohort. And we'll talk about the differences and how some of the research nowadays is looking at being able to differentiate between a neurological-based impaired concussion to a whiplash-based concussion. And some of those papers, some of the research has come from University of Buffalo, where people like Leedy, amongst others, have looked at different tests, ocular motor test, exercise intolerance test, and be able to differentiate between this. And we'll touch on this and how you could use this in your practice to be able to differentiate between a physiological, a vestibular ocular, and a cervicogenic-based concussion disorder. And we'll touch on how concussions are multimodal and very heterogeneous in their presentation. We can get vestibular, ocular motor, cognitive. We can get brainstem, migraine-based issues. We can get cervicogenic, and we can get obviously mood and anxiety types of concomitants as well. So we'll touch on some of these and how it relates again to a cervicogenic-based condition. We'll then move on to the neuro aspect of cervicogenic dizziness, and again I'll heavily reference colleagues of Julia Treleaven and co, and they've looked at a lot of this sensory motor mismatch model of how proprioceptive deficits or sensory mismatch from proprioception in the neck can contribute to a integration issue, a sensory motor integration issue that can contribute to ocular and vestibular and obviously cognitive impairments or disharmony as well. So we don't want to overlook these, and we'll talk about some of the neurophysiology behind it. And again, we'll go through a number of the cited references, and we'll break this down and we'll explain to you what this means and how it means, not necessarily to a geek like myself, to a neuro geek, but more, what does it mean in practice? How is it that I can use this in my practice? And how is it that I can discuss this with other medical practitioners or allied practitioners, so that we can be contemporary in what we see in whiplash or chronic pain patients. So we're going to talk about a very contemporary way to assess and manage. We're going to look at sensory motor from joint position sense, kinesthesia, body disassociation. We're going to look at the neuromotor aspects, biomechanical, which are the things that Ulrich will probably be covering more in his section. I'll be looking at the oculomotor and how some of the oculomotor systems get impaired with cervicogenic dysfunction like dizziness. We're going to look at balance, and we're going to look at vestibular testing. So this one slide should salivate you. It should get you excited about the sort of work that we're going to be presenting. So it's a lot of content, but we're going to break it down into a theoretical, a practical, and an integrative component. So you guys can, with some forms that we're going to provide, it's just a matter of going through these forms, these protocols, coming to an end of, okay, well, this is what's happened. This is what I've seen in my assessment. My options for management are going to be this. It's not a cookbook approach. It's always going to be based upon one's history, one's examination, and your understanding of the neurophysiology processes underneath. But based upon that, you can then tailor something that's very specific, very novel, very progressive, and very integrative into what you do. And more importantly is this is not taken away from your manual therapy or your soft tissue therapy that you do, although Ulrich will enhance that with his taping and his proprioceptive-based training, functional testing that he does as well. So there's a lot to be added to what you currently do. The trick is going to be how do you condense it, but that's something that as a seasoned practitioner you'll learn as to how to integrate that efficiently into your practice. We're going to talk about joint position error, and we're going to bring across from Australia a whole bunch of cervicogenic lasers that we're going to use to both assess and treat people with poor proprioceptive cervical joint function. I've got some posters that I'm going to bring with you with myself, and they're available for you guys to use on the day to take home with your practice. So we'll talk about that. There's a whole bunch of physical neuromotor-based aspects that, as I said, Ulrich will cover as well. We'll go through some of the evidence that talks about how to integrate therapy, when to integrate therapy, how long you should use it for. So if you're concerned about, management care plans and you're unsure about how long someone should be in your plan of care, well, we're going to talk about how Julia Treleaven and her colleagues have developed nice algorithms and nice programs to help guide you with your exercises, management, and how to assess them and when to move them on to the next phase of care. So we'll go through this, and this is a treat. It's something you don't want to miss. And obviously, balance and spinal joint function is obviously influenced from a top-down approach as well. As much as it's a bottom-up, it can be influenced from a top-down. So we're going to look at oculomotor, we're going to look at vestibular, we're going to look at the vestibular spinal influence. So how does the vestibular system affect the spine? How do we take a brain-based approach or a top-down approach in looking at how the spine integrates? Ulrich will be focused more on a bottom-up approach. I'm going to be looking at more of a top-down approach. And an area that I'm passionate about is obviously the vestibular system. So we're going to dive into some of the to the microscopic as well as macroscopic aspects of the vestibular system. And I'm always going to relate it to, because first and foremost, I'm a clinician. I always want to know how is it that I can use this in my practice and how is it I can get better at patient outcomes. So that's always going to be the tenet of what we do throughout this course. And we're going to spend a lot of time on the oculomotor system as well. We're going to look at smooth pursuits, saccades, vestibular ocular reflex. We're going to do some little fancy new versions of vestibular and cerebellar-based tests that are going to look at the integration of a lot of these sensors as well. We're going to look at balance and control. How is it that you can accurately measure balance, either with little technology or with some basic technology? We're going to talk about that as well. Oh, I've already shown you this, so you can ignore that one. So I guess moving forward from here, where Ulrich and I are super excited in presenting in Oslo in June 15 and 16. We've got a packed 2 days that we're going to be talking, workshopping, discussing amongst ourselves and obviously with you guys as well. So please join us. You can go to www.brainhubacademia.com.au. I'll put the link in there. Be sure to join us. It's a great value day. It's an action-packed day, 2 days. And we're guaranteeing that you'll walk away with a lot of information that's very applicable. So please join Ulrich and myself for what plans to be a great 2 days. Thank you.